Hi, this is Dr. Catherine Dow. I'm a rheumatologist and founder of Room 101. Thanks for watching my videos. They're meant to be educational and not as medical advice. If you have questions, please see your provider. So I saw a patient today, 67-year-old male. He comes in limping. He says that symptom started last night. He woke up, his foot was so painful, couldn't even put a sheet on it. And then by the morning time, it felt like it's broken. So after running tests, I confirmed what I believe that he has, which is gout. So gout, that's what we're talking about today. What is it? How do you prevent it? This is a two-part video series. The first part, I'm just going to go over the overview. And then the second part, I'm going to talk about treatment. So gout symptoms, basically this is an acute inflammatory arthritis. It occurs very quickly. Could be within a day, within 2 days, or even like in an instant. They know that their foot's tingling and it's very painful. Typically it affects 1 to 2 joints. And natural course in history, it will resolve within 7 to 10 days without treatment, but it is really painful. So what are the risk factors for gout? Being a man, being postmenopausal female, being on certain medications such as low-dose aspirin, diuretics, cyclosporin, having kidney dysfunction, or a family history of gout can also predispose somebody to gout. And the way we diagnose it is we obtain labs. Uric acid can be high, but not always, because during an acute flare, the uric acid actually might be normal or low. So whenever we check uric acid, we'd like to see what the uric acid is, even during a flare as well as without a flare. But the gold standard is actually taking a needle, putting it into the joint, pulling out fluid, and looking at it under the microscope to see if we can find uric acid crystals. X-rays can be suggestive, so it can look like a rat-bitten erosion around the bony joint. But there are new technology now that we also use to quantify and help us to diagnose gout. This is the dual energy CT. We have to think about other causes of an acute inflammatory arthritis. So it might not necessarily be gout, or it might be that gout occurs with another condition, such as trauma. Did the person stub their toe, drop something on their foot? Could it be an infection? So gout and infections can occur concomitantly. And then there's also other crystalline arthritis, such as pseudogout, hydroxyapatite crystals, calcium crystals. And then there's other inflammatory arthritis, such as rheumatoid arthritis and psoriatic arthritis. So gout can be extremely painful, and if left untreated with recurrent flares, can cause significant damage. We see patients with nodules, so those are crystals that form under the soft tissue, skin, and we call that tophi. So watch my next video for the treatment.